Welcome to the Pulmonary Hypertension Association's video series on frequently asked insurance questions. This video will explain the four main parts of Medicare. Medicare is a federal health insurance program primarily for people aged 65 and older. However, if you apply for Social Security disability assistance and you're approved, you'll become eligible for Medicare 24 months after that approval, no matter what age you are. You can be eligible for both Medicare and Medicaid. Being eligible for both is called being dual eligible, and it happens if you meet the criteria for both Medicare and Medicaid. PHA offers a separate video at phassociation.org that also explains the eligibility criteria for Medicaid. There are four main parts to Medicare, typically referred to by the letters A, B, C, and D. So Part A is inpatient care and hospitalization. Part B includes outpatient care, including outpatient tests and doctor's visits, as well as durable medical equipment like wheelchairs, medication pumps, and oxygen equipment. Part D includes prescription drugs. Part C is also known as Medicare Advantage, and it's actually a way to combine Medicare Parts A and B into a single healthcare plan. Medicare Advantage is a health insurance program where the federal government contracts with common health insurance providers. You could have a Medicare Advantage plan from AARP, Humana, Blue Cross Blue Shield. You would still have Medicare in that case, but that privatized plan would combine your original Medicare, Medicare Part A, the inpatient care, and Medicare Part B, the outpatient care. Some Medicare Advantage plans also combine Part D. With Medicare, most people are eligible for Part A for free, usually because their spouses have worked 40 quarters over their lives to be eligible for Part A. But with Part B and Part D, there's typically a monthly premium. So Part C combines all of those pieces into a single plan with a single premium. Medicare Advantage also typically has an annual out-of-pocket maximum, which Part B does not. So for example, if you're receiving outpatient services or have medical equipment, you are often responsible for 20% of those costs all year round, no matter how much you spend. Whereas with a Medicare Advantage plan, there's often a cap on how much you're responsible for over the course of the year. Every Medicare Advantage plan is a little bit different. Those are private contracts between the Advantage provider and the government, and so it's helpful to just know what you're looking for and do some research. Not every plan works well for everyone. Medicare typically won't cover all of your medical expenses. For example, if you have original Medicare, Parts A and B, you would be responsible for a 20% coinsurance or 20% of the allowable cost for any services that you received under Part B throughout the year. Some patients with pulmonary hypertension choose to purchase individual insurance to help cover some of those expenses. It's also possible to purchase something called a Medigap plan or Medicare supplement to help cover expenses that aren't covered under original Medicare. When you become eligible for Medicare, it's important to make your coverage decisions promptly. Postponing selecting your coverage and applying for Medicare can actually lead to long-term costs in the future. You can find more information about different types of Medicare and choosing a plan at www.medicare.gov. A lot of PH care teams also include someone who's knowledgeable about selecting insurance coverage, navigating your insurance benefits, and possibly even lowering your out-of-pocket cost responsibility for PH medications. So you may want to ask your physician if there's a nurse or financial counselor on your PH care team who can answer your questions. You can also learn more about the different types of health insurance, Medicare, Medicaid, veterans benefits, individual plans at phassociation.org or by calling 301-565-3004, extension 749.